But first, let's get straight to our Kayla Tausche. She's on Capitol Hill with some details of the GOP's new health care plan. Morning, Kayla.
Good morning, Sarah. Well, the plan put forth last night by House leadership, dubbed the American Health Care Plan, dismantles the taxes and subsidies from Obamacare and in their place puts tax credits and expanded savings accounts for customers to buy their own insurance. It keeps coverage intact for dependents under 26 and those with pre-existing conditions. But it's the structure of those tax credits which get more expensive the older a customer gets and actually makes your premium go up if you let your coverage lapse. That was central to a compromise between the Republican Party over the last few weeks. But the question for conservatives and would-be supporters now is how much will it cost? Because the draft language essentially says that this new legislation will be paid for by the repeal of Obamacare. We will hear from the Congressional Budget Office momentarily on its score for the legislation. But here's Budget Director Mick Mulvaney this morning.
We will know what it costs before they vote on it. But I think everybody who's looked at it knows that this is going to save a dramatic amount of money. Once you repeal the mandate in Obamacare, you repeal the taxes in Obamacare, you repeal the penalties in Obamacare, and you get out of that government-centric system, the CBO score is going to be very positive and helpful long-term to the deficit.
While the White House has largely left the policymaking to the leaders in Congress, one thing that it has vocally endorsed at CPAC and in the joint address last week is the ability of insurance to be bought and sold across state lines. That's something that the insurance companies fought because they didn't like it, and it's actually missing from this draft. But that's because it wouldn't survive the Senate rules on reconciliation. It's new policy. It doesn't have to do with the budget or the revenue to the government. Trump tweeted this morning, the president saying that will be phase 2 and 3 of rollout. In a separate tweet this morning, he took ownership of the plan. He called it our plan, sort of implicitly endorsing this plan that the House leadership had put forward. So we're going to see on Capitol Hill, guys, whether Senate criticism of this plan still remains now that they've been able to get their hands on the draft, or whether they still have issues with it going forward.
Something, Kayla, that the big insurance companies who have met before with President Trump inside the White House are going to be on board with?
Well, it's unclear, and even if they are on board with it, Sarah, this won't be implemented for several years. The Medicaid freeze happens in 2020. The phasing in of some of these new parts of the plan won't happen until 2018 or 2019. So they're going to have to grapple with the existing infrastructure of the Affordable Care Act for at least the foreseeable future. So we'll see which parts of this they like, which parts of this they don't like. But insurance companies have been vocal against selling insurance across state lines because from a regulatory perspective, it's pretty complicated because they don't know which state's regulatory regime to comply with. We'll see how they wrap their heads around that one.
All right, we'll wait for word from the industry. Kayla, thank you. For more on this new bill set to repeal and replace the Affordable Care Act, let's bring in former CMS administrator during the Obama administration, Andy Slavitt, and Michael Barnes, a former drug and healthcare policy advisor to President Bush. So, Andy, we'll start with you because of all your work with Obamacare. How far apart is what the Republicans announced from the actual ACA that President Obama implemented?
Well, good morning. I think the bill is pretty far from the ACA, but more importantly, it's also far from President Trump's own goals. The president has said that he's going to put forward a replacement bill that would cover more people, or at least the same number of people, more affordably. This unfortunately doesn't do that. It cuts millions of people from the Medicaid rolls, and it increases people's costs by eliminating the co-payments and deductibles. And by eliminating the individual mandate, which may not be popular, analysts estimate that's going to bring the cost of premiums up by about 25%. So this doesn't meet the core goals, let alone where the ACA, I think, which helped millions of Americans.
And just to be clear, I mean, we don't know exactly what the cost of it will be and how many people will be affected, what the premiums would look like, Michael. But do you agree with that assessment?
I agree with some parts of that assessment, which is what also some of the U.S. senators have said, which is that we don't really think that this plan is going to cover enough people because without an individual mandate repeal that is somehow balanced out by a stronger incentive to get people to buy insurance, you don't have enough base for there to be the affordability that is necessary for people to be able to get quality health care and to be able to sustain a system. Largely, this bill, what I see in it is it's a lot of politics. but it's very short on sound economics and creating a system that would be viable in terms of health care for as many Americans as needed. And ultimately, I think that we do know that there will be phases 2 and phase 3, but the risk here is we've got these fundamental reforms that include the tax repeals that undermine the system, but we don't have guarantees that phases 2 and 3 are going to create economic sustainability and quality health care for the array of people that are covered by the Affordable Care Act.
What about this idea, Andy, of the tax credits? Do you think it's going to be enough to cover the low-income population who needs health care?
I don't think it is. I think that...
sorry, that was for Andy. And then Michael, you can weigh in after.
I think Michael and I are going to end up agreeing on this. I think particularly for people who are 55 to 65, they're going to see their premiums go up very significantly and their tax credits will be reduced. So I think there's an estimate that for a 60-year-old, the average premium increase is going to be about $3,500. The same is true for people who are at the lower end of the income spectrum. And what happens when people can't afford insurance is the only people that tend to buy it are the sicker people. So this is not only going to cover fewer people, but it's actually not going to be good for the risk pool either.
Michael?
Yeah, I have to agree. Ultimately, we have to create a system whereby people have strong incentives, if not a mandate, to buy health insurance. And this notion of a 30% increase in premium is not enough because people already suffer and they take the risk not to buy insurance knowing that it'll be expensive if they have some sort of catastrophic health event that requires them to spend. 30% additional is not enough of an incentive, so there's got to be something stronger to get people to buy insurance when they're healthy. And that's not in this plan. Hopefully it would be in something that would come out of the U.S. Senate as a moderating influence on this House bill.
Right. All right. So, Michael, again, one of the key problems with the ACA has been the lack of participation from healthy young people to take the risk in the pool down, I guess, which is why you have some insurers pulling out of exchanges. I'm hearing both of you say you don't see anything in this plan that changes that, correct?
That's right. What could be done is that there could be some vital insurance reforms that were necessary before the ACA and now are necessary during the continuity of the Affordable Care Act that would reduce the administrative costs and put greater controls on the insurance industry, putting, as Republicans would like, patients and their providers back in charge of care and reducing costs by adequate cost sharing and rationing that's conducted by the individual healthcare consumer and not by these insurance that are effectively serving as, in many cases, Sarah Palin-like death panels. So there are fundamental reforms that should be made to the ACA and it can be market-based that should be in a compromise version that would be influenced by the U.S. Senate Republicans.
Speaking of which, we do have the Portmans and the Murkowskis of the world saying it's not going to adequately protect Michael. We're going to hear from the Freedom Caucus later on today. Rand Paul's already called it Obamacare light. Can you envision a compromise that brings those polls together?
I do, because I think you're hearing from these U.S. senators who are very strong on economics and understand what is necessary to create a sustainable health care system. And, by the way, they're conservatives like Rand Paul and Mike Lee, but also representative of states like Ohio and Alaska with Rob Portman and Lisa Murkowski, those states that potentially stand to be the hardest hit, the red states, by the current proposal from the U.S. House. And so I think that the U.S. Senate could be a very moderate influence that creates a system that is sustainable if they can get their hands on this bill.
Yeah, that's why they're phasing out the whole Medicaid expansion. Final word to you, Andy. The Republicans want to get this bill before both chambers before the April 7th Easter recess. Is that realistic at all?
Well, they're asking Republicans in states like Ohio and Pennsylvania and Louisiana to take an awfully difficult vote to really take billions of dollars away from their state for Medicaid expansion, take treatment away from opioid addiction. I think it's going to be very, very tough to see Republicans, moderate Republicans, particularly from those states, get on board with something that looks even remotely like this.
Which would mean it could take a lot longer. Guys, we'll leave it there. Thank you very much for joining us today. Andy Slavitt and Michael Barnes.